Thank you, Mr Chairman. Thank you for the opportunity to speak in this debate on the entity Mid-Central District Health Board. And Mrs Kedgley is correct in pointing out that the Mid-Central District Health Board has undertaken some of its own work to look at the status of rest home auditing and monitoring in its own region. And it's done within the context of a quite serious situation that we in government inherited. And that is set out in the report which has informed the work of Mid-Central District Health Board, and that's the quite damning report of the Auditor-General, which Mrs Kedgley is acknowledging, even though she's travelling around the country with the people who actually are damned in the report. And that report sets out very clearly the failure during the period 2002 to 2008 to correctly monitor performance in our nation's rest homes. And this is very much the theme picked up in the Mid-Central report. What the Auditor-General said that was, despite knowing about a number of shortfalls in the monitoring of rest homes in New Zealand as early as 2004, the previous government failed to act. The previous government failed to act on the issue of rest home monitoring and auditing. And that is... The member says we turned down the aged care inquiry. We don't want inquiries when we want action. We don't want inquiries when we want action. And that was an Associate Minister who was panned, her governance was panned in the Auditor-General's report. The Auditor-General's report was highly critical of the Ministers of Health under that government. Remember, they had 3 in 3 years, who failed to act on the poor state of monitoring in rest homes. So, as the Mid-Central report says, there are a number of changes that are needed, and this government has acted. The first thing that we were very concerned about, and it was a feature of the Mid-Central report because they talked about the importance of clinical engagement and leadership in a lot of these rest homes, was to deal with the quality of nursing supervision in our nation's rest homes. So one of the first things we did in last year's budget was put an extra $18 million into subsidies to aged care, specifically to improve nursing supervision and numbers in rest homes. Very important investment. We've followed that up this year with an additional $16 million increasing subsidies for aged residential care. So they got a 5% increase last year, and they're getting an additional increase, $16 million this year, with a real push on nursing quality and supervision in our rest homes, because that was something that was picked up by the Auditor-General and by this Mid-Central work that Mrs Kedgley is talking about. But we've followed that up even further. We've introduced a spot auditing regime. Now look, many members would be surprised to know that when it comes to this mid-year audit, they used to ring up the rest home and say, we're going to be arriving on this date. Well, hello? Does that mean you get a true look of what's happening? You may do, you may not. So we've introduced spot auditing, where we don't tell the rest home the date that the auditors are going to turn up, and that is very important. What's more is we've said, look, the people in rest homes and the families of people in rest homes and the people considering going into rest homes need more information about the performance of rest homes. That's why for the first time, despite this government being asked to do it, that previous government, this government has, we have put those audit results online. And we've provided an easy colour coding in order to look at how rest homes are performing against the key quality criteria. It starts from blue, meaning a very good performance, through to red, which is poor performance. And when there is red, poor performance, there's a requirement on the rest home to address those concerns. Much of this, as is pointed out in the Mid-Central report, hinges on the designated auditing agency, the third party that comes in and audits the rest homes. And the government has been concerned about the auditing process because, as Mrs Goodhue pointed out in her discussion paper on aged care policy in 2007, a lot of these rest home audits are contradictory. They can be done within weeks of each other, and they were contradictory. So we've been looking at this audit process with particular scrutiny on the auditing agencies. And one of the initiatives of this government, which is in line with the Auditor-General report, is to bring in third-party accreditation of the auditing agencies. So that means the auditors themselves now have to meet an accredited standard in order to audit rest homes. Now, this is This action was announced last week, a week or two ago, by Mr. Speaker, Mr. Chairman, by myself as Minister of Health. This follows a program of auditing the auditors. Last year we sent the Ministry of Health in to audit the auditing... more bureaucracy. Well, actually, more bureaucracy. Do we want to care for the old people in rest homes or not? And it's not more bureaucracy. It's not more bureaucracy because it's actually dealing with this problem where you can have duplicate audits with saying completely contradictory things. So we've audited the auditors, we've brought in third-party accreditation for the auditing agencies, and we are reviewing the auditing process, so much so that the Ministry of Health is now briefing the auditors directly on how they do some of their work. Now look, all of us have visited rest homes from time to time to visit some of our most vulnerable New Zealanders there. Earlier this year I went with my children, Maisie and Llewellyn, to go and visit a rest home in Te Puke. And I can tell you there that it's very clear that most older New Zealanders in rest homes are getting very good quality service. They're getting looked after by people who care and love for them and people who are doing their level best for them. And those frontline workers deserve our support and admiration for what they're doing. But there is no doubt that there are a number of cases of people not getting the quality service that they need, and that is the reason why this government has invested in nursing quality and supervision in rest homes. We've brought in accrediting of the auditing agencies. We're smoothing the audit process so that we don't get these contradictory audits. We're reporting the results online, and we are engaging with DHBs on how we make sure we get a better service there. The key thing, though, is you can have all the auditing you like, but you've still got to make sure you get good quality care for the staff, good quality care for the residents. And I think anybody who's visited a rest home recently would be able to tell you that actually we've done a pretty good job in staffing our rest homes in the last 18 months because work has been difficult for many people and turnover has dropped dramatically in the health sector. And I visited a rest home last year on the Kapiti coast that said for the first time in years they'd had a number of people apply for nursing positions. Previously, they'd struggled to even get one person to apply, but they got others to do it, and so we've been able to get good staffing in many of our rest homes around New Zealand. What I would say, though, is it's very easy to beat up scaremongering stories. You saw one today in the House, Mr. Chairman, where it was alleged that we'd taken away Meals on Wheels in Helensville. While actually, the truth of that is 8 people are now going to be covered by the general service for Meals on Wheels and home support in the Waitemata DHB. They're still going to get their Meals on Wheels. They'll be getting the same, if not better, service as a result of that. Very easy to put out a press statement saying, as it was saying, starvation inevitable as a result of those changes, but very important to know the details. Very important to know the details. Now, what the good people at Mid Central have done in their work on rest homes is to identify the importance of a number of factors. One is they've identified that there are some risks around smaller owner-operated rest homes. They've indicated there's some risk when there's some large turnover of staff or management in particular. They've identified that when there are complaints, that is also a red flag of further investigation being needed. Now, that is all being adopted into the changes that we are making in rest home supervision, because what we inherited was not a good situation. The Auditor-General, not the National Party, the Auditor-General tabled a report before Christmas that damned the governance of the previous government. They said they knew that the state of rest home monitoring was appalling and they did nothing about it. And it took this government, led by John Key, to start dealing with the issues. What we see from that party opposite is trying to rewrite the history of their neglect of rest home monitoring and supervision in New Zealand. And as I travel around the country, I can tell you more and more people are wise up to the political game that's going around the country on this Rest Home Select Committee, because they know that the people that they're talking to were ministers in a government that neglected rest home nursing and supervision neglected monitoring, neglected dealing with the auditing agencies, all issues that this government is dealing with, all